Watch this video till the end to know what are all the important books you have to read if you are joining dermatology residency as a first year junior resident. Watch this video till the end. Myself, Dr. Maddineni, friends, I teach dermatology for UG students and also for PG students. So these are my qualifications. I have done my diploma from JSS Mysore and DNB from Hindura Hospital. These are my vision and mission statements. I do discuss dermatology related topics in my YouTube channel and also in Telegram and also Instagram. So these are my channels and groups. And as you can see, many students have requested me to make a video related to the dermatology books. That's why I am making this particular video. I hope you might have watched this video related to dermatology as a career option. If you have not yet watched it, I will leave the link for that in the iCard and also in the description and also in the comment section below. So a small disclaimer, this video is going to contain my views from my own experience. And yes, if you ask other residents, their views may be different, and you should also take the perspective of your concerned dermatology departments, and finally the decision is going to be yours, and try to make an informed decision by considering all the inputs which you have received. And also, if you are a soft copy lover, then you can keep all these books as soft copies. Almost all of them are available as PDFs. But if you are a person like me who likes to read from the book, from the paper, then watch this video till the end. You will get an idea which book you have to buy as a hard copy. Okay, so let's begin the video. I would like to thank my HODs, Dr. Jaydev Betkarur, Dr. Veerana sir, Dr. VK Khurana sir and RK Gupta sir from JSS Mysore and Hindur Hospital respectively. And I will keep the links for all these books in the description. You can check them out. And I welcome you, a hearty welcome to all of you. Since you are watching this video, I hope you have joined your derma residency and you are watching this video to get idea about the dermatology related books. Okay, so hearty welcome to all of you into the dermatology department, which is a cool branch with not so much of emergencies, and you can also pursue your interest along with the studies. So you all might be well aware that after the completion of this 3 years of residency in dermatology, we are going to have this DVL as our degree. So you can see it can be MD or DNB, DVL, okay, or if it is a diploma, DDVL will be there. So what does DVL stands for? Dermatology. Not just dermatology, we are also going to see patients with venereological conditions, that is sexually transmitted disease, and also we are going to treat leprosy also. So we are not just going to read dermatology but STDs and leprosy. And not only that, we have to diagnose the conditions, so diagnostically related books and also therapy, of course. Finally, we have to treat the patient, so therapy related books. So all these books I am going to cover in this particular video. So unlike most other subjects branches, dermatology is a visually challenging branch. So if you see a patient with a particular lesion, you can easily diagnose. Most of the times you can easily diagnose the cases, but if there is any difficulty in the diagnosis, then you can take the help of the subject pathology, that is Dermato Pathology. I will discuss this in the upcoming slides. So just like in various religions, there are holy books, like for example Gita, Bible and Quran. So in dermatology also we have such holy books which are to name ROOKS, Bolognia and Fitzpatricks. So I will tell about each of these books. So I will tell you about the ROOKS from this slide onwards. It has 4 volumes. So this is just for example purpose. So related to psoriasis. So the information in the ROOKS textbook will be from various sources, various journals, various articles. It will be taken from, as you can see, it will be rich with not only just the information, and also there will be histopathological images, and also there will be clinical pictures also. And also you can see the treatment will be given in the form of treatment ladder. So that is about the ROOKS. Whereas now coming to Bologna. No doubt ROOKS is considered a standard textbook, but there are some cons. Like for example, ROOKS textbook does not have good flowcharts or tables to differentiate certain dermatological conditions. Whereas Bologna, it is best of both the worlds. Why? Because there will be information in this, just like how ROOKS has, and also this has one beautiful thing, that is tables. As you can see here, there will be differential diagnosis which will be discussed side by side, and also you can see there will be beautiful flow charts also, like how to manage particular condition, how to diagnose particular condition. Okay, so this is the beauty of Bologna. Now coming to the Fitzpatrick. So this is also one more standard book apart from ROOKS and Bologna, and in this book also, just like Bologna, there will be information, standard information, and also there will be a table, as you can see, and also there will be beautiful flow charts also in this Fitzpatrick textbook of dermatology. Now coming to the Indian perspective. So all those things were standard books, no doubt, but the small problem is that they don't talk much from Indian perspective. Whereas to deal with this small issue, we have this book called IADVL textbook of dermatology. IADVL stands for Indian Association of Dermatologists, Venereologists and Leprologists. So the picture which I have kept is the 4th edition. Right now 5th edition, the latest one is there. I am also planning to actually buy this book. This is a must-have book for all of the Indian dermatology residents. Okay. So as you can see, this also has a beautiful tables in this format. And yes, so that was about the Indian textbook, that is IADVL textbook of dermatology. There are some honorable mentions, like for example, Andrews Diseases of the Skin and Clinical Dermatology by Thomas Habif. So I would suggest you to read these books if you have completed the previous ones which I have told. So basically these are just single volume books which you can keep during your practice on the consultation table, and whenever you have any queries you can just flip through the pages and you can check all these books. The beauty of these books is that they are just one volume, but almost all the diagnoses which you can think about, the details of those diseases conditions will be there in these two books. So that is the beauty of this. But definitely these books should not be considered to be read. You should not consider to read only these books. These books won't be sufficient. You have to read. So I will tell what is my suggestion. So IADVL is a must buy. Why? Because it will give the Indian perspective. And rest, what you can do is basically all the books you cannot buy. So I would suggest you to download the PDFs. PDFs are available in almost all Android and iOS, both of them you can download. So download these as PDF and try to read few chapters and find out which one do you like, and try to buy the hard copy of that, of course, along with IADVL. And what I would suggest is, whenever you see any case, so basically dermatology or any for that matter any subject, it is not read cover to cover. This my HOD VK Kurana sir used to tell. So the textbooks in the post graduation are not to be read cover to cover, but you have to read them disease by disease. Like for example, if you see a lichen planus patient, then read ROOKS, read Bologna, read Fitzpatrick, read IADVL, and then try to make some notes, some important points from each of the book. Try to make a concise notes in the form of notebook, or you can also write it as in the form of a PDF, in a PPT, or in a Word format, or you can make a sticky notes and stick them in IADVL book or in one of the standard books which you have selected for yourself. Okay, so this should be the approach, and this is my final suggestion. Okay, so I cannot tell you which book will be yours. Why? Because you may one may like Rooks, other may find Rooks a waste, or one may find Bolognia great and other may find Bolognia waste. One may find Fitzpatrick great, awesome book, and other may find that Fitzpatrick is a waste book. But one thing is clear, IADVL you must have, because you are going to get Indian perspective. The other books, definitely I will leave the decision for you. Definitely I told you what are the pros and cons in the previous part of the video. You can watch that, and if you like whatever it you may like, you can decide for yourself and take an informed decision. And now coming to, we have completed the general dermatology part. Now let us look at the venereology, DVL. So venereology, we have sexually transmitted disease, and initially in the first year, most likely you might not have to read from the textbooks of STD. So all that you need to do is just see this CDC guidelines will be there for the sexually transmitted disease in the form of PDF. Also it is available in the CDC website, so you can read those guidelines. They will be very much updated, up to date information will be there, including the treatment as well. So you can follow this CDC guidelines, and also of course in India we have a NACO website. You can also follow NACO website as well. Whereas coming to the standard textbooks of STDs, we have the two of the old ones. One is King and Nicol. So you can see here Ambrose King and Claude Nicol. So this is a we can say a very ancient book. So it is very old. In fact, when I was there in JSS, I got this from my JSS library, and I got it xeroxed. Okay, so in this, and also in the other one, King K. Holmes. So King K. Holmes, these two are actually considered as standard books in STD. But the problem with King and Nicol is that it is a very old book, almost ancient book, and the treatments in this book definitely are outdated, absolutely outdated. So don't follow the treatment part in the King and Nicol, but the description, the clinical features, the history and all will be beautifully given in the King and Nicol. So for this you can definitely read this book. And honestly speaking, this book King K. Holmes, I have not got so much of time to read this book from cover to cover. It is a very a huge voluminous book. So what I did was the conditions which are very important, or which had case presentations where there were any journal clubs, I used to just take a printout of few of the topics which are important, and I used to read them from the printouts. Okay, so that is, honestly speaking, I have not read this book, but definitely this book is considered to be a standard book, and there is in fact a new edition, 5th edition. This is the 4th edition which I am showing you. I will leave the link for the latest edition in the description below. And this is the just like IADVL textbook of dermatology, this is for sexually transmitted disease, so by Vinod K. Sharma sir. But the problem with this book is that this is an older edition book related to IASTD, so the treatment may be changed from what is given in this book. So you, for the treatment part, you can follow the CDC guidelines. So this book right now, what you are seeing is of the size of a standard textbook. Okay, but there is a latest update, a small handbook is there by the same Vinod K. Sharma sir, and in this you can see some diagnostic and also some diagnostic procedures, and also some information related to vaccination, and some information related to the newer treatment modalities has been added in this short notebook. We can say it's like a notebook size, but very rich in the latest updates related to STDs. Okay, and now coming to the final one, DVL, leprosy. So in the leprosy we have some standard books, like for example Jopling's handbook of leprosy. This is just like a small handbook. But there is a latest edition I will show in the next picture. And also for leprosy, there is one more book with the name Hastings. So either of these books you can read for getting historical perspective of the leprosy, because leprosy is a very old disease. And as you can see, the newer edition of Jopling's, which is 6th edition by Kabir Sardana sir, is there in the market. You can buy this book and read. This is very updated edition in which almost all the details of the treatment in the form of vaccinations and also immunotherapies for leprosy have been included. And also there is one Indian Association of Leprosy book, that is IAL textbook of leprosy. As you can see, Dr. Bhushan Kumar and also Dr. Hemant Kumar Karsar, both of them were editors, and this is also a good book. This is not a handbook, mind you, this is a textbook, proper textbook with many journals and articles being quoted in this book. So now let us move on to the next part, that is the investigation, that is management part, in which we have investigations and therapy. So you all know that all the clinical branches, almost all the clinical branches, they depend upon the radiology for the diagnosis, because for the treatment, diagnosis is important. Whereas dermatology is one such branch, clinical branch, in which the for the for the diagnosis, radiology is not required, but definitely for dermatology, it's a clinically challenging branch. By just looking at the lesion, we can diagnose, but there will be certain conditions which will be very difficult to differentiate when we are going to take the help of pathology. Okay, pathology. So now we are going to see, I hope you have seen this video. In this, I have actually explained about the observerships and fellowships which are available right now in India after you complete MD, DNB or diploma in dermatology. So if you observe carefully, there is one such field, that is dermatopathology and also aesthetic dermatology. So so in dermatopathology, just you have to know the names of them. Lever's histopathology book and also Weedon's histopathology book. These are the standard books for histopathology for the purpose of references. Okay. And definitely you cannot read them cover to cover. They are huge books. All you can do is any particular condition, when there is a diagnostic dilemma, then you can just go through, review these books and try to get some points which are related to the condition which you have sent biopsy for. And of course, there is a small handbook from Indian author Dr. Venkatram Mysore sir. Okay, so this is Fundamentals of Pathology of Skin. This is a small book. Just read this to get orientation of dermatopathology, to get to get yourself used to the dermatopathological terminologies. But this book, there are some small minor mistakes in this book, so you cannot consider this book to be a standard book. Definitely you can use this book for your reference purposes, okay, to know the terms, and if there are any mistakes, okay, you can make the corrections in this book as well. I hope maybe there is a newer edition to this. Please check out in the description. I'll give you the links for all these books. But if there is any newer edition, if you are seeing this in the year not to 2022, but if you are watching this in 2024 or 2025 or later on, there might be newer editions, so please do check out for the newer editions. And now finally we are going to see the therapeutic part of the dermatology. So for Dermato Therapeutics, I can say that the most standard book is Wolverton. And what is the peculiarity of the dermatology from other subjects is, in dermatology we are going to use topical medications, and topical medications are exclusively used in dermatology. So exclusive book should be there in which the topical agents and their pharmacokinetics, pharmacodynamics, and also side effect, adverse effects, and clinical features of the diseases and the drugs, the dosages, how many times they should be used. So all these should be given in a very different way rather than which are given in other books where only systemic, that is oral or IV medications are used. So this is a very standard book, so there is no way, definitely 100% mandatory you must buy this book. If you are a soft copy lover, so you can get the Elsevier soft copy versions of these from expertconsult.com. In that you can buy these books as soft copies, and the beauty of this soft copy is that once you buy these as soft copies with login credentials, as you can see, you can open the chapters. So this is systemic retinoids, and you can highlight these, you can add notes to this PDF. So this is not downloadable PDF, this will be available in the website. Expert consult, you can watch, you can read these books, or there is one app called as Inkling. One second, I will write that. So INKLING, Inkling. So in this app, you can log in with your credentials, username, password, and you can check out all the books which you have bought as soft copies, and you can again continue your reading from this app, that is from the mobile as well. So that is the beauty of this, and you can see there will be beautiful tables. No doubt this is a must buy, 100% mandatory. Wolverton. The name of the book is Comprehensive Dermatological Drug Therapy. The author is Stephen E. Wolverton. And definitely there is one another book for Dermato Therapeutics. The author is Lebwohl. Okay, I think it's not clear here. Lebwohl. This book is not so much famous. I don't know why, but this is a beautiful book. If you ask me why, because in this book the dermatological conditions will be given in an alphabetical order, and in a particular disease, what are the first line therapies, what are the second line therapies, what are the third line therapies, all this will be clearly mentioned along with the journals and along with the articles, and also there will be level of evidence which will be mentioned, and also like what I have told, this book is also under Elsevier publication, so you can again buy this as a soft copy, and you can highlight them, and you can just read from any tab or any laptop system or even mobile phone after you download this, and you can highlight and also add your own notes to this PDF soft copy. And also, of course, you have Pubmed, which is absolutely free. In this Pubmed, you can search for any condition, like for example derma rollers. If you want any latest articles related to derma rollers, you can just type in and search here, and if this particular article is available free, you can click on this and you can read the complete article. And of course, there is one more subscription, just like Netflix, Amazon, Hotstar. There is UpToDate subscription, which if you take, you can again read all the latest updates related to all the dermatological conditions. I do not have the subscription for this, but definitely if in your institute you are having the access for UpToDate, definitely make use of it. Do not waste it. Okay, it has beautiful updates. As you can see, the name of this is itself is UpToDate. So there will be all updates related to particular disease, ranging from just topical preparations, even systemic preparation, and also procedural dermatology related aspects also will be covered. And my mentor HOD Dr. Veeran sir, sir was a fan of a very old book by the name Shelley and Shelley. So Shelley and Shelley. So this book actually sir used to say so many times, but I have never found this in the Google. So but this book was available luckily in the JSS library. So I took this book and I have made a Xerox of this, and this is a very funny book. Again, in this book also the conditions, the dermatological conditions will be given in alphabetical order. And why is this book very peculiar? Because all the possible interventions which a particular disease can we can use, all those will be included, but along with that there will be some funny case series or case reports in the form of small diary, or we can say the experiences of the Shelley and Shelley. Basically they all these will be there, and this is if you get hands on of this book, definitely make it Xerox and keep this book. It is going to be really a very fun based learning if you want to do related to the conditions of dermatology. Please make this book as a Xerox and keep it with you. You can, this is a very old book, as you can see it is 1987, but still the way in which the treatment modalities have been explained in this book is, it is awesome. Definitely it is very funny, and also this will have certain quotes which are very funny. Okay, the quotes will be there in between the book, they are also very funny. And if you read this book in a funny way and also in a thought provoking way, the Shelley and Shelley, they will try to make you remember what are the therapeutic procedures which a particular condition, particular disease in which we can make use of it. And I wonder sometimes, because in this book there are certain medications, there are certain medications which are given, which are actually very new to the time when this book was there, but still those medications, they are even under trials even right now for those conditions. Okay, so that is there is some magic in this book. So if you get a chance to get this book Xerox, this is not available to buy anywhere, get this Xerox and keep it with you, it will be handy for lifelong. And then there are, procedural dermatology, dermatosurgery related books, that is ACSI. This is Indian version of the procedural dermatology, but definitely you cannot read this cover to cover. This comes in 2 volumes. So you can just buy these books, and during your minor OT procedures, okay, you can read about few of the RFC, electrocautery or lasers. Okay, so like that you can cover few of the topics. Definitely you should not plan to complete this book cover to cover. Why? Because actually dermatosurgery is a fellowship, and you have to read this book in 1 or 1.5 years or 6 months in a fellowship. In that time you can happily read this book. And some honorable mentions, like for example Moschella, it was very old edition, actually 3rd edition, extremely ancient book. While I was doing my diploma and even when I was doing my DNB, there was no any newer edition which came into the market. But in the JSS, this book was given emphasis for the basics which this book had. That is the 3rd edition. Basics were beautiful, so I made Xerox of that, and I have read the basics part of this from this old edition. But right now, as you can see, there is a newer edition, there is a 4th edition, but honestly speaking, frankly speaking, I have not bought this book. I don't know how this 4th edition has made the changes in the basics which were there in the 3rd edition. Okay, so if you get hands on the soft copy version, just check out the initial 300 pages and just see how the basics are given in this 4th edition. If you wish to buy this, the links I have kept in the description. but definitely I am not sure how this book is changed now, how this is given right now. So all the links I will put them in the description, and definitely there are many other books also, like for example ward rounds in dermatology and DYP survival guide for postgraduate. This book, the second one, which is DYP survival guide, this actually will be given by one of the medical representatives. Okay, so all you need to do, so I don't think I can write that, I don't know, so I have not written. So the medical representative, they will come to your department and they will gift you this book, so you can ask them and you can take that book. And this book, Ward Rounds in Dermatology by Dr. Belaja Shah, and this is also a beautiful book. This is very thin book. Okay, this DYP survival guide, I will tell you one thing. This is actually, the intention of this book was very good actually. Why? Because this will help us during the case presentations and in the ward rounds. Why? Because there will be almost all the diseases will be covered, ranging from inpatient uh, that conditions, that is pemphigus vulgaris, bullous pemphigoid, leprosy, cutaneous lupus, systemic lupus erythematosus, subacute cutaneous lupus erythematosus, DLE, erythroderma, all the conditions, psoriasis, all of them will be covered. But the problem is there are some minor mistakes in this book. So that is the reason why this book has some modifications which have to be made, but unfortunately they are not being made. But otherwise the intention of this book is great. So now that we have completed what are all the books which are important for the dermatology residency, if you wish me to make a video on what are all the aspects in the first year which you are going to see, that is the academics, or we can say journal club or case presentation, how to deal about the ward rounds, how to select the journals while you are going for the academics, the journal clubs, the CMEs, how should your approach be, and in the conferences what you should expect, what you should do in the conferences. If you wish me to make this video on part 2, that is how, why and what in the dermatology residence, ఎందుకు ఏమిటి ఎలా, just in the comment section type part 2 if you wish me to make the second part of this particular series on dermatology residency related queries. The first part we have seen the books, and second part if you wish to see the topics about the in this given in the slide, please type in the comment section part 2. So myself Dr. Maddineni Srinivas, friends, if you wish to get all the dermatology related updates, join my telegram groups, telegram and Instagram groups, and also subscribe to my YouTube channel for all the latest updates. I am also actually thinking to make videos related to DNB. Relatively some students feel that is a difficult exam, DNB, and also MD theory papers. I want to cover these in my YouTube channel, and also obviously the practical exam OSCE. So these things I want to cover in the future. So if you wish to watch these videos as well in the future, in the then please do subscribe and also join my groups. Yes, the links for the books I will keep them in the description below. And if you have enjoyed this video, if you are having any dermatology residents as your friends, please do subscribe. Please do share this video to all your friends. Why? Because sharing is caring. And I thank you so much, friends. I will leave the timestamps for this video because it might be very lengthy and difficult to focus. So I will leave the timestamps. And thank you so much. Myself, Dr. Maddineni Srinivas, friends. Do remember to subscribe to this YouTube channel and also hit that bell icon to get all the notifications as and when I make a video and post it in my YouTube channel. And also do share this video among your friends. and also hit that like button, friends, if you have really enjoyed this video, and if you have got some insights. If you have any more queries, suggestions, feedbacks, comments, please do leave all of them in the comment section. So thank you so much, friends. Happy learning dermatology. Sarvam Sri Krishnarpanam. Sarve Jana Sukhino Bhavantu. Bye bye.